Hello, dear students. Again, we are forced to do online classes because of the emergence of third wave of coronavirus. I hope you are fine and safe. First of all, stay home and be safe because health is the most important thing in our life that we are supposed to understand. So far, we completed many chapters in the offline mode and online mode as well. Here, I'm going to restart the online class with the chapter number 13. Why do we fall ill? Today, the whole world is discussing about the coronavirus and the health related issues that can bring that virus. So, it is very important to know this chapter that what are the illness that can be affected to us in the form of different types of diseases which affect our health. The main content that we are going to discuss in this chapter: concept of health and disease, classification of disease, means of spread, principle of treatment, and principle of prevention. Out of these five topics, in this video, I'm going to cover up the first three topics. The rest of the two will be discussed in the next part. So first, let's start with the concept of health and disease. What is meant by health and a state of disease? Health is a state of well-being enough to function well physically, mentally, and socially. That means if a person is well-being or being well only physically, that doesn't mean that person is healthy. If the same person is disturbed mentally or socially, so all these aspects should be together being well, then only we can call that is a state of health, or that is a healthy person or healthy condition. Now, if any one of these three factors affect us in a negative way, then that will lead to the state of disease. It is a disturbed ease, which means being uncomfortable. One or more systems of the body will change, give rise to symptoms, signs that in the form of cough, loose motion, pus formation, headache, fever, etc. So all these are actually symptoms. Symptoms is actually a sign which is shown by our body to indicate our body is in the state of disease, which means something is affected to the health state of health. So these symptoms are taken by the doctors to diagnose the disease. What kind of disease affected, and what kind of treatment can be given, and how it can be cured. This all will be done with the help of analyzing the systems. So these are the things you have to remember regarding health and disease. Now let's discuss the classification of the disease on the basis of different criteria. Based on the period of time, the diseases are classified into acute and chronic disease. That is one type of classification. Secondly, based on the cause of disease, what agent caused the disease, they are classified into infectious and non-infectious disease. So first let's start with the acute and chronic disease. Let's discuss the differences, major differences between acute and chronic disease. First of all, understand what is an acute. The disease that which lasts only for short period of time is called acute disease. From the name itself, we can understand easily. For example, common cold. Most of us already may be affected this common cold almost in the every year. So this is actually lasts maximum of 3 to 4 days or maximum up to 1 week. Unlike this, the chronic disease actually is a kind of disease that lasts for long period of time, which means almost around throughout the life. For example, asthma. That's a disease which is affected throughout the life. Maybe most case that throughout the life that person has to suffer the consequence of the asthma. Secondly, the patient recovers completely after the cure. If the patient undergoes a treatment for any acute disease, that patient will recover completely after the treatment because it lasts only for a short period. While in case of asthma or any other chronic disease, patient does not recover completely. Even though the strength of the disease can be reduced, but the mild symptoms or mild effect will be continuous throughout the life. And there is no loss of weight or feeling tiredness afterward, or which means when the disease affected during that short period, it may be uh, tiredness will be the or feeling of tiredness will be, but in case after it is treated, there will not be. While in case of chronic disease, there is often loss of weight or feeling tiredness that will be there consistently without going to the complete healthy state. And there is a short duration of loss of work and efficiency, same as I told you that. In case of acute disease, during that period of time when the disease is affected, that time that person may not be, or the person who is affected may not be able to work completely. Or his efficiency may be reduced to a certain percentage only during that time. While in case of a person who is affected chronic disease, there is a prolonged loss of work and efficiency because that disease cannot be completely cured. So this is the differences between acute disease and chronic disease, which are actually classified on the basis of period of the time which affect. Now let's move on to the next classification, that is infectious and non-infectious disease. We know that this classification is done on the basis of cause of the disease. So first of all, let's see what are the common causes of the disease. Most of the diseases have many causes rather than one single cause. Clear, it can be from the different sources like unclean water, lack of nourishment or problems in the nourishment, genetic difference, genetic abnormalities, etc. These are the common causes. There are many. It cannot be listed in a table. That much causes are there. Based on these causes, they are classified into non-infectious and infectious. So if the causing agent is non-infectious, then that type of disease is called a non-infectious disease, not affected by infectious agent, mostly from internal and not a non-infectious cause. For example, cancer. Most of the cancer type of cancers are actually in non-infectious. At the same time, there are some cancers which are infectious as well, like the case of some viruses which may cause liver cancer. But major category of the cancers are actually comes from the genetic abnormalities. And secondly, the infectious disease, which is caused by infectious agent. In most cases, they are microbes like bacteria, virus, protozoa, etc. The example of this disease that is cholera. And now we are moving on to the last part of this video, that is the different methods of the transmission of infectious disease. In most cases, non-infectious disease cannot be transmitted easily, while the infectious disease can be transmitted easily because they are caused by the infectious disease or it is caused by the external agent, unlike non-infectious. So let's see what are the common methods of transmission. The picture depicts very clearly that what are the different modes of the or means of spreading the diseases, especially communicable diseases. First one is direct contact. Direct contact means handshaking, hugging, kissing. These are actually direct contact. Through this direct contact, chickenpox can be spread. So chickenpox is an example of disease which can be spread through direct contact. So it is better to avoid direct contact with a person who is affected chickenpox or similar disease. Secondly, by the air. When an infected person sneezes or cough, at that time the air bones come out of his mouth can be transmitted to the air, and slowly it can be spread throughout the air in that surrounding region, and it may, when the next person inhales that air through the respiration, the microbes that contain the airbornes can be entered into the healthy person. By this way it can be spread. An example of this is tuberculosis. Next one is indirect contact. Even though if there is no direct contact, if you are going to use the articles like clothes, mug, cup, whatever it is, which are used by the infected person, then also we can get affected, because when we touch those articles, microbes which cause that particular disease may be attached to that articles from the infected person. So when we touch those articles, that microbes also become attached on our body surface and it may enter to our body. An example of this is COVID-19. This is the reason why we are advised not to touch on the unknown places, like especially the public gatherings are done. Now, another method, that is food. The disease, certain disease that can be spread through the contaminated food. An example of this is cholera. And next one is the very important one, that is we have to understand the disease that can be spread through mosquitoes and insect. They are the carrier of most of the diseases. Mosquitoes, other insects like housefly. An example of this is dengue. The microbe which causes dengue fever is carried by the mosquito. Now lastly, that is rabid animal, like a dog. So certain diseases can be transmitted through the rabid animal, not directly from infected person to the healthy person. There are some viruses which present in their body that can be directly from those animals to the healthy person when we contact with that animal. In most cases, these types of diseases spread from the rabid animal, which are actually, we'll call it as the rabies. So these rabies diseases are actually, in most cases, it is transmitted through the biting of the animal on the healthy person. An example of this is hydrophobia. Hydrophobia is a very dangerous disease. Actually, the word hydrophobia means fear of water. So these are the some common methods of transmission of the diseases, especially communicable, which means they are belonging to the category of infectious disease. So this is all about the first part of the chapter number 13, why do we fall ill. I hope you got clear idea about this first part, and that's all from my side, students, for today. I will come with the next part in the next week. So thank you for watching.